A cup of coffee a day could keep your heartbeat more regular. A new study out this week showed patients with AFib who drink an average of 1 cup of coffee a day had fewer issues with their symptoms. So joining us now with these new findings is our 9 News medical expert, Dr. Payal Kohli. And then we know that Chris Bianchi's peeking in the background because he loves his coffee.
He's got a question.
So what is AFib, first and foremost?
Yeah, so AFib, or atrial fibrillation, very common heart arrhythmia. Unfortunately, the prevalence of this condition is going up in this country. And the most common risk factor for AFib is aging. So as we get older, our heart gets a little bit stiffer. The electrical cables can sort of stretch out. High blood pressure, obesity, diabetes, sleep apnea, all the things that we're seeing more and more of cause AFib. And AFib basically means the atria, the top chamber of the heart, instead of squeezing in a nice coordinated fashion, sort of jiggles. And so that causes an irregular heartbeat, causes your heart to race, palpitations, you don't feel well, but it can also cause blood clots, which can then go on to cause stroke. So it's a pretty serious condition and something we don't really know a lot about how to prevent.
What did this study specifically say about caffeine and its role? Because is it a good thing or a bad thing?
So this is what doctors have been scratching their heads about forever. And patients ask me every single day, my heart patients, should I be taking coffee, especially caffeine, with coffee? And there were some studies that showed benefits, some that showed harm. So this was what was called a randomized study, which is a really good type of study, which controls for everything else. It took 200 patients with AFib who had been put back into a normal rhythm, either through a shock or through medicines, and then said, okay, now that you're back in a normal rhythm, you drink 1 cup of coffee a day and you abstain from caffeine and all coffee substances for 6 months. We'll see who gets more AFib. So that controls for a lot of the background factors, and there was a 39% lower chance of having AFib if you drank that cup of coffee a day.
So is it the coffee or the caffeine?
We don't know, but we think the coffee, because it may not be the caffeine. Caffeine, as you know, especially in high doses, can be stimulating to the heart. There are people who have genetic susceptibilities to caffeine to get more jittery. It can raise your blood pressure. So we think it's probably the substances in the coffee that's doing it. We don't know if this would apply to other things such as energy drinks. I don't think you should ever take an energy drink. That's my opinion as a cardiologist. But certainly it opens the door for us to tell our AFib patients, and even more broadly, I would say to tell heart patients, that drinking a cup of coffee with caffeine in moderation every day is probably okay for your heart, may actually be beneficial.
Is this something you're now going to tell your patients to add that into the repertoire of all the healthy things they should be doing?
If they're coffee drinkers already, Alex, then I'll say yes. If you're not a coffee drinker, it may not be a bad idea to think about a little bit of coffee, because there's a lot of substances in coffee, anti-inflammatory substances, antioxidants. We know that coffee has magnesium, has potassium, has micronutrients. So it's not obviously the caffeine, but the other substances in coffee that can have protective health benefits in moderation. In fact, the dietary guidelines recommend a cup of coffee as part of a healthy diet.
A cup of coffee. So what? No lattes with sugar and all that,
Such
right?
an excellent point, Sam. And in this study, they didn't actually control for what you're adding into your coffee. They did control for background alcohol use, because that can trigger AFib too. And so they did control for that and had kind of similar. But yes, if you're filling it up, I went to Starbucks the other day, I got a latte. I saw her make it, and she put 5 pumps of sugar
too much.
Bam,
into
bam, bam, yeah.
And then I had this horrible headache afterwards.
Yeah.
And so really we have to be mindful of the cream, the pumps, the additives, all the things we're putting in our coffee. We also have to be mindful of too many cups of coffee, because the culture is, start drinking coffee all day long. There's a dose-response relationship. And we just have to keep that consumption of caffeine to less than 200 milligrams a day. So 1 cup is about 120 to 150 milligrams. So about 1.5 cups, nice clean coffee without a lot of the stuff. Are you a Starbucks drinker?
I'm actually quite good at that. I don't like my things too sweet when it comes to
black coffee?
No.
You can do it.
Okay.
So you can put a little bit of cream or a little bit of milk. If the black is too much, because it can be acidic, so it can trigger heartburn for some people.
I do a little bit of maple syrup and a little bit of oat milk.
That sounds
Look
okay.
at her face.
So fancy.
But I'm just happy that heart patients can drink coffee. I think that's huge for so many Americans, and hopefully you won't put too many pumps of that maple syrup in your coffee.
Copy that.
No whipped cream.
Noted, Dr. Kohli. You can find more with Dr. Kohli at 9news.com/Dr. Kohli.